Good afternoon, everybody, and welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Dorothy Shephard, Minister of Health. Bonjour tout le monde, bon après-midi et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont la médecin hygiéniste en chef, le Dr. Jennifer Russell, et l'Honorable Dorothy Shephard, ministre de la Santé. Dr. Russell.
Bon après-midi à toutes et à tous. Good afternoon, everyone. Avant de commencer aujourd'hui, j'ai le triste devoir de vous annoncer qu'une autre personne du Nouveau-Brunswick est décédée des suites de la COVID-19. Une personne d'une quarantaine d'années, résidant dans la zone 1, soit la région de Moncton et du sud-est du Nouveau-Brunswick, est décédée de problèmes de santé sous-jacents, y compris la COVID-19. Cela porte donc à 30 le nombre de décès depuis le début de la pandémie de COVID-19 il y a un an. Je tiens à offrir mes plus sincères condoléances à la famille et aux amis de cette personne. Mes pensées et mes prières accompagnent toutes les personnes touchées par ce décès tragique. Before I begin my remarks today, I have the sad duty to report that another New Brunswicker has died as a result of COVID-19. An individual aged 40 to 49, residing in Zone 1, which is Moncton and Southeast New Brunswick, has died due to underlying medical complications, including COVID-19. We have now seen 30 deaths since the COVID-19 pandemic began 1 year ago. I want to send my deepest sympathies to the family and friends of this individual. My thoughts and prayers are with everyone who has been impacted by this tragic loss. This is sad news for all New Brunswickers, but I am confident that better times are ahead in our journey through this pandemic. Get ready to roll up your sleeves because vaccines are on their way, New Brunswickers. We do have a plan to get a dose of protection against the COVID-19 virus into every New Brunswicker between now and Canada Day. We are moving forward with a significant acceleration of our vaccination plan. La première phase du plan, à savoir vacciner les résidents très vulnérables des foyers de soins et des autres établissements résidentiels pour adultes, les travailleurs de la santé de première ligne et les résidents de Première Nation, est presque terminée. Nous allons désormais passer à la deuxième phase qui progressera bien plus rapidement que prévu. Grâce à l'approvisionnement toujours croissant en vaccins, et aux nouvelles données scientifiques étayant le rapport d'inoculation de la deuxième dose, nous pourrons vacciner toute la population du Nouveau-Brunswick bien rapidement. The first phase of the plan to inoculate the very vulnerable residents of nursing homes and other other residential facilities, frontline healthcare workers and First Nation residents is almost complete. We are now moving into the second phase, which will advance much more rapidly than we had originally planned. With an ever-increasing supply of vaccines and new scientific evidence supporting a delay in administering the vaccine's second dose, we will be able to complete the work of inoculating all New Brunswickers much more quickly. The All-Party Cabinet Committee on COVID-19 and Cabinet has approved an updated vaccine rollout. And this plan, Minister Shephard will be speaking to the details very shortly. Our plan will ensure an equitable distribution of vaccines across the province. It will give priority to those who continue to be at a greater risk from the COVID-19 virus, not only from the effects of severe outcomes, but also the effects of transmission. It will use the resources of the public health care system and our partners in community pharmacies. It will allow us to build immunity to the virus in our population. It will enable our economy to keep moving by providing vaccinations to New Brunswickers like truckers, rotational workers, and regular cross-border commuters who travel outside the province for work. And in time, it will make it possible for us to loosen some of the restrictions now in place for public movement and gatherings. Cela dit, même si nous passons à la phase suivante de notre plan de rétablissement, il est absolument crucial que tout le monde reste sur les gardes à l'égard de la COVID-19, Can everybody just mute their mics, please? S'il vous plaît, si vous pouvez mettre votre micro sur muet, parce que je peux entendre, il y a beaucoup de bruit sur le téléphone. Étant donné qu'il faut au vaccin 14 jours pour être efficace, tout le monde, même ceux qui ont été vaccinés récemment, doit continuer à respecter les consignes et les recommandations de santé publique. Nous devons tous continuer à porter un masque dans les espaces publics à l'intérieur tout au long de la campagne de vaccination. Chaque citoyen doit se maintenir à une distance de 2 mètres des autres dans la mesure du possible. As we move into the next phase of our recovery plan, it does remain vital that everyone remain on guard against COVID-19. Because it takes at least 14 days for the vaccine to be fully effective, everyone, including those recently vaccinated, must continue to follow public health advice and guidance. While we get vaccines into the arms of New Brunswickers, we must all continue to wear a mask in indoor public spaces. Everyone must keep 2 meters of physical distance between themselves and others when possible. We must all watch for symptoms of COVID-19 and stay home from work or school when symptoms emerge. We really do need to keep getting tested. I can't stress this enough. We have to keep our testing numbers as high as possible to make sure that we're very confident in our statistics and in our data and in protecting our population. So if you even have mild symptoms, please get tested. The finish line is now within sight, but we are not there yet. We must maintain our focus on limiting the impact of COVID-19 on New Brunswickers, and this is especially true in light of the variants. We know that in places like Ontario, they went from 30% of the cases being related to variants of concern to now 40% of the cases are as a result of variants of concern, and we are seeing surges in cases in Ontario and indeed stricter measures and lockdowns in certain areas. Aujourd'hui, il y a 3 nouveaux cas confirmés de COVID-19 au Nouveau-Brunswick. Tous la zone 1, soit la région de Moncton et du sud-est du Nouveau-Brunswick. 2 cas sont des contacts d'un cas préalable lié à un voyage. Le 3e est toujours à l'étude. Nous comptons désormais 33 cas actifs de COVID-19 dans la province. Parmi ceux-ci, une personne est actuellement hospitalisée. Je vous demande, comme toujours, de garder ces concitoyens du Nouveau-Brunswick dans vos pensées et vos prières. Votre soutien est toujours nécessaire et va toujours droit au cœur des personnes dont la vie est touchée par ce virus. Today, there are 3 new confirmed cases of COVID-19 in New Brunswick, all of which are in Zone 1, which is Moncton and southeastern New Brunswick. 2 of these are contacts of a previous case related to travel, and 1 remains under investigation. We now have 33 active cases of COVID-19 in the province. This includes 1 individual now in hospital. As always, I ask that you keep these fellow New Brunswickers in your thoughts and prayers. Your support is continually needed and always appreciated by those whose lives are touched by the virus. The vaccine campaign that began in December is nearing the end of its first phase. D'ici mercredi prochain, toutes les personnes du Nouveau-Brunswick vivant dans les foyers de soins ou un établissement résidentiel pour adultes auront au moins reçu 1 dose de vaccin. Cette même journée, nous passerons à la phase suivante de notre campagne, étant donné qu'il sera possible pour tous les Néo-Brunswickois et toutes les Néo-Brunswickoises de plus de 85 ans de se faire vacciner sur rendez-vous dans les pharmacies locales. Veuillez garder à l'esprit que pour le moment, seules les personnes de plus de 85 ans ou la personne appelant en leur nom doivent prendre rendez-vous pour se faire vacciner. Les autres tranches d'âge et groupes professionnels suivront sous peu. By next Wednesday, we expect that every New Brunswicker living in a nursing home or adult residential facility will have received at least 1 dose of a vaccine. And on that same day, we will move into the next phase of our campaign as vaccine appointments at local pharmacies will be available to New Brunswickers over the age of 85. Please bear in mind that only people over the age of 85 or someone calling on their behalf should book a vaccine appointment at this time. Opportunities for other age and work groups will follow shortly. Please be patient. Your turn is coming. And I can't stress this enough in the sense that we do know that in other jurisdictions, systems have become overwhelmed with people making lots of phone calls, et cetera. Please wait your turn. As of right now, it's for those people that are 85 years and older. During the remainder of March, we will provide vaccines to a number of higher risk groups, including healthcare workers and people with complex medical conditions. As mentioned, we will give priority to people who regularly cross our borders, including rotational workers, to reduce importation of new cases into our province. In April and May, with sufficient supply, we will provide vaccines to New Brunswickers over the age of 60, as well as to people aged 40 to 59 who are vulnerable to infection due to medical conditions. And we will have some information that we'll be sending out to healthcare providers about these conditions. If all goes according to plan, every New Brunswicker should have the opportunity to receive their first dose of a COVID-19 vaccine by the end of June. That is great news, and we are really very much looking forward to those doses being put in the arms of New Brunswickers. There are a number of factors that have enabled us to accelerate our vaccine campaign. We are now receiving a much larger volume of the mRNA vaccines manufactured by Pfizer and Moderna. Great news. We're very, very excited about this. We have confirmation from the National Advisory Committee on Immunization that delaying the second dose for up to 120 days is scientifically sound. And really and truly across the country, we do have a consensus that trying to vaccinate as much of the population with at least one dose is the safest approach at this time to protect our population. Another factor is the arrival of new and more user-friendly vaccines. During March, New Brunswick will receive our first shipment of 10,500 doses of the AstraZeneca vaccine recently approved for use in Canada. A further 50,000 doses of this vaccine are expected to be delivered during April and May. The new vaccine does not require ultra-cold storage or freezing, as is the case with vaccines now in use, and this will enable us to extend the reach of our vaccine campaign. During the next phase, the AstraZeneca vaccine will be provided to several groups of first responders, as well as to others providing frontline services to the public. It will also be used to vaccinate extramural program clients under the age of 65 who are unable to travel to community vaccination clinics. With the recent approval by Health Canada of a fourth vaccine manufactured by Janssen, we can plan to add to our vaccine supply as we move through the spring and summer. I want to remind everyone that all vaccines approved by Health Canada are effective in preventing severe outcomes of COVID-19. When your turn comes, please take whichever vaccine is provided to you. The more people that get immunized, the quicker we will achieve a level of protection across our population, and this will be an exciting time for New Brunswick and its people. Every week, we will have more stories to share of family and friends receiving protection from this virus that we have been living with for over the past year. And I did receive anecdotal information today from a citizen whereby their mother-in-law, who is 92 years old, did receive their appointments for their first and their second doses of vaccine. So we must keep this in context. Receiving the vaccine will not end the pandemic, but it will help to reduce the most severe impacts of the virus, including ICU admissions and deaths. We will continue to live with COVID-19 for some time to come. And as the virus continues to be present in the rest of North America, there will be more outbreaks here in New Brunswick, which is unfortunate. But when they happen, we will respond with swift and sure measures as we have done for the past 12 months, and as we've seen recently in Zone 7 in the Miramichi when we actually had an outbreak involving the variants. The UK variant in particular. After a year, we all know what we must do to limit the spread of COVID-19. I urge all New Brunswickers to continue to protect your friends, families, and loved ones. We are getting through this. In the weeks ahead, we will make a giant leap forward in our journey toward a new normal. Let's continue to work together so that we will all arrive safely at our destination. Thank you very much.
Merci Bruce, merci Dr. Russell. Good afternoon, bonjour. Sadly, today we are mourning the loss of another person who has died as a result of underlying conditions, including COVID-19. On behalf of all New Brunswickers, I want to extend sincere condolences to the loved ones of this individual. You are in our thoughts and prayers at this difficult time. As Dr. Russell has said, more vaccines are coming, and this is good news for New Brunswick. More vaccines mean we can move up our distribution timeline and get vaccines into the arms of New Brunswickers sooner than expected. The more people who are immunized against COVID-19, the harder it is for the virus to spread. That, along with following the restrictions associated with the alert level you are in, will save lives. As well, more vaccinations will allow us to lift further restrictions. We have updated our rollout plan based on the increased number of vaccines we are expecting. Using all vaccine available as a first dose by Canada Day will significantly improve protection for every New Brunswicker. We are taking this approach based on Health Canada's approval of additional vaccines, the confirmation of more doses coming to Canada and to New Brunswick, and the new guidance on dose intervals indicating the second dose of the vaccine can now be delayed up to 4 months. First dose clinics for residents of all licensed long-term care facilities in New Brunswick are expected to be completed by March 17th. Clinics took place this week to vaccinate more than 10,400 people, including residents and staff, at 56 licensed long-term care facilities. Clinics have been held in First Nations communities this week and will continue next week to offer the first dose of vaccine to community members aged 16 and over. It is expected that all First Nation residents will receive their first dose by March the 19th. To ensure we can continue to vaccinate New Brunswickers in a timely and efficient manner, we have been in discussions with our partners, including pharmacists, Horizon Health Network, and Vitalite Health Network. As was announced yesterday, beginning next week, community pharmacists will start vaccinating eligible New Brunswickers. For right now, eligible New Brunswickers are individuals 85 years of age and over. Vaccines in community pharmacies will be appointment-based, and appointments can be booked by people who are 85 years of age or older or by their caregiver or family member. Walk-in appointments will not be available. Some pharmacies may have an online booking tool on their website, and you are encouraged to check before calling. If you're not comfortable booking online, seek someone out who might make it possible. And if that isn't an option, you can call a pharmacy for further information about how to make an appointment. It is important that you only book one appointment in one location. Our collective success depends on everyone working together to ensure that none of our vaccine is wasted. Also, please do not call a doctor to get your vaccine. Primary care providers will play a role in the vaccination plan in the months ahead. However, they are not administering vaccines in their office at this time and will not be accepting appointments with patients for that reason. Once those aged 85 and older have had an opportunity to get the vaccine, we will proceed with those who are age 80 and above, followed by those who are 75 and above. And if you're not yet 85 or older, or calling for someone who is, please do not make an appointment at this time, and I cannot stress that strongly enough. Your turn is coming. Please be patient. In addition to the community vaccine clinics, Horizon Health Network and Vitalite Health Network will be holding clinics next week to vaccinate groups such as first responders, healthcare workers, and health system staff. If you fall into one of these groups, you will be contacted directly about how to make an appointment for the vaccine. Individuals with complex medical conditions will also have an opportunity to get vaccinated at these clinics. To be determined if you're eligible, visit gnb.ca/coronavirus and click on vaccine. The COVID-19 vaccine page on the GNB website also contains information on who is currently eligible to get the vaccine and how to sign up for an appointment. An announcement will be made when other priority groups and age groups are eligible to receive the vaccine based on supply, but currently the plan is as follows. People aged 75 and over, as well as truckers and regular border commuters and rotational workers, will be eligible to receive the coronavirus vaccine before the end of March. We had promised to address the burden placed on rotational workers and their families by the virus, and have been able to do so by vaccinating rotational workers sooner in the updated vaccine rollout plan. Our goal is to be able to ease restrictions around their need to self-isolate as soon as we can. We will share more information on this as it becomes available. Throughout April and May, residents and staff of communal settings, people between the ages of 40 and 59 with 3 or more chronic conditions, home care workers, long-term care volunteers, and those aged 60 and older will be eligible to receive the vaccine. Extramural will be providing the vaccine to patients who are housebound and unable to travel during this period as well. Also, during the month of April and May, large employers of more than 200 employees will begin offering vaccine clinics to healthy members of their staff who are 65 and under. This will ease the burden on pharmacies, Horizon Health Network, and Vitality Health Network so they can immunize more people. In June, those between 16 and 59 who have not been offered a first dose will be vaccinated, and larger employers will continue to offer vaccination clinics. Second dose clinics are expected to begin in June, if not earlier. If all goes as planned, every New Brunswicker who wants the vaccine will receive at least their first dose by the end of June. That is less than 4 months away. I appreciate that so many New Brunswickers want to receive the vaccine. I ask that you continue to be patient and to wait for your turn. New Brunswickers have played an invaluable role in keeping our COVID-19 numbers among the lowest in the country. And that's because New Brunswickers have been following public health advice and have avoided actions that would overwhelm services. In the same way, we ask you to wait your turn before trying to book an appointment for vaccinations. We have seen other provinces rolling out their vaccination program for members of the public. We've seen how booking systems elsewhere have been overwhelmed and how residents of some provinces have been forced to queue up to wait for vaccines. We don't want that to happen here. Our plan includes a gradual, sequential rollout. If you book an appointment but don't meet the eligibility, you will be turned away at your appointment without getting a vaccine. When that happens, not only are you taking a spot from someone who is eligible, but you are slowing down the overall process. Even with the increased rollout of vaccines across the province, it is important to remember that COVID-19 is still with us. We must all continue to work together to follow the advice of public health and to keep one another healthy and safe. I know this is a lot of information and that your first inclination is to reach out now to try and book your appointment. Please don't do that unless you are 85 years of age or older or calling on behalf of someone who is. I want to assure you that all of this information will be available online at the GNB website. We will also continue to share updates and we'll let you know when it's your turn to sign up and how to book your appointment. If you want to get the vaccine, you will have the opportunity to do so. We've gotten to this point by working together, and that is how we will see this through. Thank you. Merci.
Thank you, Minister and Dr. Russell. Merci beaucoup, Minister Shephard and Dr. Russell. We'll now proceed with questions from members of the media. Each reporter will have one question. Please ensure you identify who you're addressing to answer your question. You have the right to pose your question in the language of your choice. Please ensure your microphones are placed on mute. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue officielle de votre choix. Chaque journaliste aura une question. Pourrez-vous, s'il vous plaît, identifier clairement à qui vous adressez pour répondre à vos questions? Et voulez-vous assurer de désactiver le son de vos micros? Héloïse Rodriguez, Radio-Canada.
Oui, ma question est pour Dr. Russell. J'aimerais savoir, vous avez mentionné ça plusieurs fois, c'est quoi les leçons que vous avez apprises des autres provinces dans le déroulement? Qu'est-ce que vous avez appris? Qu'est-ce que vous pensez faire mieux qu'ailleurs au Nouveau-Brunswick dans ce déroulement?
C'est une très bonne question. Ce qu'on a appris des autres provinces et territoires, c'est que si la planification est bien faite au niveau de faire certaine qu'il y a un endroit pour les gens d'aller prendre les vaccins, mais aussi la manière que c'est pour inscrire pour avoir un vaccin, c'est très complexe et ça prend beaucoup de planification. Et si c'est pas bien fait, ça veut dire que beaucoup de monde va essayer de contacter pour avoir leur vaccin tout en même temps. Ça marche pas. C'est pour ça qu'on veut que les gens du Nouveau-Brunswick faire certaines qu'ils se patientent et quand on vous donne l'information pour contacter le pharmacien, le pharmaciste, l'endroit où vous devrez prendre votre vaccin, ou si vous faites partie d'une clinique d'un réseau, attendez votre tour. On va donner toute l'information au fur et à mesure qu'on l'a. Et le prochain groupe, à ce moment-ci, c'est ceux qui ont 85 et plus âgés. Alors, ça va se dérouler prochainement. Alors, c'est vraiment important qu'on ait la collaboration et la coopération des citoyens du Nouveau-Brunswick à ce moment-ci.
Merci. Adam Harris, Brunswick News.
Hi there. Thanks for allowing me to take a question. 60-year-olds are now ahead of students on the rollout list. I just wanted to get some information behind why that decision was made.
What's your question for Mr. Harris?
I get the health minister.
Thank you, Adam. So I've been trying to clarify in the past several days that the reason that 16 to 24-year-olds were ahead of 60 to 69 was because at the time we proposed the first plan, we were not assured of supply. In fact, it was quite inconsistent with those assurances. So we were not assured of supply to get students vaccinated and clear their 14-day waiting time before the fall. We actually didn't think we'd be able to get to students until the fall. So in wanting to return to some normalcy and knowing that public health measures work, we were proposing that 16 to 24s be done before that larger group. So as things have progressed, our supply has certainly grown substantially. We know that we're going to have much more supply than we were originally told, and we have confidence in that supply. So now we can go back to the age the age groups that we had discussed earlier. That's really the short of it.
Thank you, Mr. Harris. Marie Sutherland from CBC.
Hi, my question is for Dr. Russell, I guess. I'm wondering, you announced the death person in Zone 1 today. Is this the youngest person who's died of COVID-19 in the province? And were they staying at a long-term care home?
Well, I think at this time there are people grieving in terms of family members. And I think that as of right now, it's very sad no matter what age people are when they pass away. Just for confidentiality reasons right now, I don't really want to release that information, but we may come back to that. But obviously, people of any age can have complications of COVID-19, but the higher your age and the more comorbid conditions that you have, the higher your likelihood of bad outcomes, poor outcomes in terms of hospitalization, ICU admission, and death.
Thank you. Silas Brown, Global TV.
Hi there. This is for whoever wants to take a stab at answering this. We heard during the technical briefing that temporary foreign workers are not currently in the vaccination rollout plan. These are workers that often work in close quarters and in very important pieces of our economy, as we saw last spring. So I'm curious around the decision to not have them included in the rollout plan at this time.
Hi, Silas. Great question. We are in a unique position in New Brunswick in the sense that last summer we had the advantage of learning from other jurisdictions prior to the arrival of our first temporary foreign workers. And given the information that we had from other jurisdictions with respect to outbreaks, et cetera, we made sure that all temporary foreign workers were self-isolating for 14 days and received a day 10 test when they had been in self-isolation. And what we learned from that experience was very positive, that every single person who was a temporary foreign worker who self-isolated properly and then tested positive on day 10 did not transmit to anyone else. So we were very confident after that experience that we could contain COVID-19 cases that would happen to arrive with travelers who were temporary foreign workers. So at this time, we're not changing our approach since we know that approach works. But again, this is an evolving situation, and we will always continue to review our approaches and policies.
Thank you, Mr. Brown. Vicky Hogarth, CHCL.
Thank you, Bruce. My question is for Dr. Russell or Minister Shephard. After receiving both shots, will people who've been fully vaccinated be able to leave the province and return without isolating for 14 days? And this includes, but isn't exclusive to, rotational workers.
So I'll start that one, Vicky. Basically, we have a lot of waiting to do right now, and we have a lot of patience that we have to exert at this time. We're still learning about what's going to happen after these vaccines are given. As you know, the first dose is not effective in terms of efficacy of protecting a person from the effects of COVID-19 until 14 days after the first dose. And we are planning for most of the population to get that second dose at the 4-month mark, which is now endorsed by NACI, the National Advisory Committee on Immunization. And so the people that will get that second dose, we will have to look at what the risks are and what kind of measures we will have to continue to impose or not impose on those individuals.
And just to build on that, we know that COVID-19 and the variants are, all around New Brunswick, maybe without the exception of Nova Scotia too much being as much a concern, but Ontario, Quebec, Maine are still dealing with these numbers, and we have to be careful. So I think it's too early to talk about opening up for travel. We will always be continuing to work, with the data we receive, with our colleagues in other provinces, and I think it's really important for us to just, as tiring as it is, we can't take these off in too big a bites because the data changes every day, and every week. And so we need to be using the most up-to-date information we can. So I guess I would, in the end, just say, stay tuned.
Thank you, Minister. Thank you, Ms. Hogarth. Michel Corriveau, Radio-Canada.
Oui, merci, Bruce. C'est une question pour Dr. Russell. Alors, Dr. Russell, j'aimerais que vous nous expliquiez comment les vaccins seront distribués dans les différentes régions du Nouveau-Brunswick pour ce qui est des pharmacies. S'il vous plaît.
Oui, vous voulez savoir combien de doses vont être distribuées aux des pharmacies ou le transport?
Michel, peux-tu clarifier votre question pour le docteur, s'il vous plaît?
Oui, bien sûr. J'aimerais savoir, il y a des gens dans certaines régions qui s'inquiètent de ne pas avoir assez de vaccins dans leur région, dans les pharmacies, dans différentes régions. Comment s'assurer qu'il y a suffisamment de vaccins dans chacune des régions, même les petites régions plus éloignées?
Alors, la planification a inclus le pourcentage de la population de chaque âge qui est dans chaque région. Alors, le nombre de doses qui vont être distribuées dans chaque région est basé sur l'information qu'on a dans chaque région sur la population et les âges des gens qui demeurent là.
Minister Shephard will add to it.
So I just would like to add that we have 218 pharmacies throughout the province who have come on board to help us with the distribution of vaccine. And so we have a medical pharmaceutical company who is responsible for the distribution and whatever other resources they use throughout the province. So we're confident that we'll reach everyone.
Thank you, Merci, M. Corriveau. Before we go to Jacques Poitras, Dr. Russell would like to add a point to Adam Harris's question.
Yeah, so Adam had asked about that age group again, the 18 to 24-year-olds, and compared to the 60-year-olds. And when NACI gives us recommendations around the priority groups, they do have a lens to look at all of the different groups with respect to risks from age, from comorbidities, and vulnerable settings. But they also look at what they see in terms of the risk for transmission. And anecdotally, what we're seeing in certain outbreaks right now, including outbreaks with the variants of concern have about 100% attack rate, which is different from the strains that we're used to seeing. So when they affect a daycare center or restaurant staff, those are younger people, obviously, who are working in those facilities sometimes, public-facing workers and employees. So PEI has actually adopted an approach whereby front-facing, public-facing employees in that age group are going to be vaccinated. And again, this will continue to evolve and change because of the variants and because of information that we're getting from other jurisdictions. But as of right now, we're comfortable with the plan the way it's rolling out at the moment.
Thank you, Dr. Jacques Poitras, CBC.
I see on the plan graphic that people with complex medical conditions will be vaccinated in RHA clinics. What's the criteria for them establishing that they have a complex condition, and how will people without family doctors go about that?
That one with Dr. Russell.
So a couple of points around that. Number one, we do have a list of what those complex medical conditions include, and we will have a way for people to be able to present that information to the pharmacy locations where they'll be getting immunized. For the RHA clinics, that part I would have to come back to you on, but my understanding right now, we are going to be sending information out to healthcare providers around those complex medical conditions. It will be available, I'm assuming, on the website as well. So people will be able to see themselves and identify themselves that way. It's an honor system, so we won't be asking family physicians to document and confirm that these people have these complex medical conditions. But again, we're taking people at face value in an honor system, as other jurisdictions are.
And there will be vaccine command center that will help pharmacies delineate some information if they have any questions. So we're going to be as responsive in a very quick fashion so that we support pharmacies through and the RHAs through this process, and extramural as well. Many pharmacists, of course, would have patient records that they're going to be dealing with their, their drugs alone can tell them what many chronic conditions could be. And also when it comes to the online, I believe there's going to be a significant amount of information online at the request app for the vaccination. So, I won't say there won't be hurdles, but I think on the whole, as Dr. Russell said, we have an honor system, and I think most people will respect that.
Thank you. Maria Vassano, Radio Canada. Justin Dupuis, l'Acadie Nouvelle.
Oui, bonjour, question pour le Dr. Russell. On a vu dans les médias certains reportages qui montraient qu'il y avait des travailleurs dans les foyers de soins environ 50% des travailleurs dans les foyers de soins avaient décidé de ne pas se faire vacciner. Ça semble montrer qu'il y a encore beaucoup d'inquiétudes par rapport à la vaccination au sein de la population, beaucoup d'opposition. Donc, est-ce que vous avez une stratégie ou un plan pour encourager les Néo-Brunswickois à se faire vacciner puis pour répondre à ces inquiétudes-là?
Absolument. On a des directions et des informations de l'Agence de santé publique du Canada et aussi dans le département de santé ici au Nouveau-Brunswick, on a des plans pour avoir de l'information pour vraiment informer les gens sur les vaccins. Certainement, ceux et celles qui vont hésiter de prendre le vaccin.
Merci. Laura Brown, CTV.
Hi there, for either of you. We heard in the technical briefing that
pharmacists don't necessarily have to get the vaccine before they administer the vaccine to however many people in their communities. I'm wondering if there's any concern about that. Obviously, we prioritize healthcare workers and those who work in long-term care homes, I suspect because of that reason. So I wonder if you're encouraging as many pharmacists to get it as possible, or what's kind of your plans for that?
So I'll take that one, and if Minister Shephard wants to add. My understanding is that all the pharmacists who will be involved in vaccination have been offered the vaccine in terms of this rollout sooner rather than later. So I'm not sure why they wouldn't participate in those vaccine clinics or that opportunity. Obviously, any healthcare worker who has interactions with the public, we're encouraging to get vaccinated.
That's good.
Long, Miramichi leader.
Good afternoon. My question is for either of you, whichever one can answer. Can you provide some clarification on the timeline for vaccine shipments to pharmacies? Because I understand that process is supposed to start on Wednesday the 17th, but I've spoken to some pharmacies in Miramichi who say they aren't receiving vaccine doses until March 23rd. So like I said, can you clarify that, please?
It's my understanding that pharmacists will be ready to vaccinate those 85 years of age and over on March the 17th. That was the most recent information I received, and I would suggest that we have provided pharmacists with, I believe, a dedicated line to assist them, and I would assume that they would be calling that. We had a tremendous week, a really busy week from public health and the task force on the vaccine rollout, and I believe on Monday of this week or Tuesday of this week we spoke with hundreds of pharmacists, and so. I can only assume that the vaccine deliveries will be there very soon.
Just add. So again, just to add to what Minister Shephard said, the vaccination rollout in terms of the delivery of those vaccines starts on March 17th, but it will continue throughout the week, throughout the end of the month.
Thank you. Tom Bateman, Brunswick News.
Oh, good afternoon. For Dr. Russell, we heard from the Premier this week that he'll be speaking with his Atlantic counterparts about synchronizing a range of COVID-19 protocol and policies across the Atlantic provinces for things like isolation requirements, rotational workers, temporary foreign workers, vaccination schedules perhaps, testing or contact tracing procedures. I just wonder if you could share perhaps from a medical perspective what this might involve and what it will do to help combat the pandemic in this region, and perhaps a timeline as well for seeing those adjustments made.
Well, Tom, we actually have regular meetings with the chief medical officers of health from across the country 3 times a week, and we meet once a week with the Atlantic chief medical officers of health to really try to make sure that we are aligned in every way possible. We do have all the same information to work with in terms of the evidence-based information, but we always do tailor that information to our jurisdictions. And certainly, if we're going to move towards an Atlantic bubble, it would make complete sense for us to have as much alignment as possible. So I assume those discussions will continue to take place, and I assume they will be quite fruitful.
Thank you, Mr. Bateman. Alexander McDougall from the Holton Pioneer Times.
Hello. For Health Minister Shephard, you mentioned something about essential workers crossing the border between New Brunswick and Maine being eligible to have vaccinations sometime about the end of March. I was just wondering if that, and then sort of just following up what Ms. Hogarth was saying regarding with the new vaccine plans and I know some of the zones are going to go scheduled from orange to yellow too. I don't know if that would affect any of the international border crossing policy, but in terms of family members maybe being able to go back again, or just general policies like that.
So Daily commuters, those who regularly travel across the borders, truckers and rotational workers, are being, they're going to be able to book an appointment with a pharmacist most likely week after next, I think. And so they'll get their vaccines earlier, which is helpful to slow the spread of COVID-19 and to protect themselves after that 14-day period. With regards to opening the borders and any further bubbles, I think that really is going to depend on what is happening in our neighboring jurisdictions and how, how those conversations will come. But I think today, as I've said earlier, the data changes so quickly. The variant is ever present. And so we will make those decisions based on data in as real time as we can.
Thank you. Erica Butler, CHMA.
I was going to ask a very similar question about people who travel regularly across the border. I guess I will ask, will people with shared child custody and people giving care to older adults who also are traveling frequently for those reasons, will they be included along with the regular cross-border commuters, rotational workers, truckers, and will they be able to get their first shot by the end of March, which seems very soon?
I don't think I can answer that today, and I don't think I could answer a yes. I think that as we progress and as the number of vaccinations go up, we can kind of presume that restrictions will start to come down. So I think that for now we have priorities based on I guess urgencies, and we'll be progressing. I'm not saying no, especially when it comes to the custody arrangements, but I think that we'll have to continue to stay updated on those things, and parents inquiring should inquire before doing traveling.
Thank you. Hannah from the St. John Valley Times.
Hi, sorry, I also have a kind of similar question, so apologies about that. But I'm wondering, currently vaccine distribution in Maine is outpacing that in New Brunswick. I'm wondering, as this side of the border, the U.S. side, becomes more fully vaccinated, if that will contribute to decisions about reopening the border, reconsidering travel restrictions.
I think Dr. Russell will follow me because she can probably speak to the epidemiology of this. But again, it is going to be all based on data. The amount of vaccine out there, theirs, ours, the amount of variant that we might see, in our midst. So it's going to be based on data and consistently being updated. But that's when we'll make decisions.
So the only other thing I have to add is that the issue around the border with the U.S. is going to be discussed at the national level. So we will follow, those conversations. And as Minister Shephard said, we will continue to follow the epidemiology.
Thank you. Marie-Ève Arsenault, Radio-Canada. Ladies and gentlemen, don't forget to move your clocks forward Sunday morning. En rappel, il faudra avancer les horloges de 1 heure dimanche matin. Thank you very much. That concludes today's update. Voilà la fin de notre mise à jour. Merci beaucoup et bonne fin de semaine.